begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in this episode, I plan to discuss the effects in which the coronavirus has on the liver once infected. Now, if you have not seen my episode on the basic functions of the liver in Chinese medicine, I suggest you go back and watch it before continuing to watch this episode so that you'll be able to better understand how the functions of the liver are to be perceived from a Chinese medicine perspective. Now, as I've stated in other episodes on the coronavirus, this virus has the ability to launch a full body assault, causing damage to organs other than just the lungs. Now, there are cases of severely ill patients having recovered from this virus to only realize that after further testing, there was evidence of its lingering effects. Now, of these apparent recoveries, there are patients that have shown signs of impaired liver function. When liver cells have been damaged, they tend to leak higher than normal amounts of enzymes into the bloodstream, which are usually indicated in follow-up blood work after recovery from this virus. Blood test results have shown increased serum levels of ALT and AST, as well as lactic dehydrogenase. Now, severe hypoxia is the major cause of hypoxic liver injury as a result of acute lung failure or shock relative to this viral infection. Now, hypoxic liver injury can be tied to metabolic acidosis, calcium overloading, and altered functions of mitochondrial membrane permeability. Immune-mediated inflammation can also contribute to liver injury as well. Now, liver damage in patients infected by the coronavirus are usually a direct cause of liver cells having been infected by this virus. Now, let's take a look at things from the eyes of an acupuncturist. Now, in my episode on the basic functions of the liver, I'd informed you that the liver stores blood, and it also ensures a smooth flow of qi throughout the body, and it opens into the eyes as well. I will note that there have been cases of patients having contracted COVID-19 and have displayed ocular symptoms. Now, you must watch the episode on the basic functions of the liver in Chinese medicine. Keep in mind that the two more important functions of the liver are that of ensuring the smooth flow of qi throughout the body, as well as storing blood. Now, liver patterns that I'm noticing in my patients who've been diagnosed with COVID-19 are liver qi stagnation, which, if remains stagnant too long, tends to show signs of internal heat, whereby the patient would manifest with symptoms of slight feeling of oppression in the chest, epigastric distension, and a feeling of a lump in the throat area, and a feeling of heat rushing up to the head. I would notice redness on the sides of their tongue and a wiry pulse. I've had 3 cases where I diagnosed coronavirus patients as having liver blood stasis. Now, the main symptoms that really resonated were that of abdominal pain, vomiting of blood, purple and dark complexion with dry skin. The pathological precursors to this diagnosis, that being liver blood stasis, of course, were cold, phlegm, qi deficiency, and blood deficiency. I also came across 2 of my patients who displayed symptoms of stagnation of cold in the liver channel. Along with the symptoms that followed this pattern, they had pronounced manifestations of vertical headache, a feeling of cold hands and feet, and vomiting of clear watery fluid. They also had a deep wiry pulse, and it was slow as well. Now, I encountered a new patient who was diagnosed as having been infected by the coronavirus. He displayed symptoms of liver yang rising deriving from liver and kidney yin deficiency. The more pronounced symptoms in his case were headache, sore dry throat, and sweating, especially at night. Now, the key here is he'd been diagnosed as hypertensive 10 years ago. So I knew I had to shed some focus on treating his hypertension in my treatment protocol. The others were existing patients who developed liver patterns after having been diagnosed as positive for COVID-19, in which I found quite interesting and wanted to share this with you guys. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?